All right, we are here with one of our best patients, Ian. Ian came to see me with tremendous back pain, right? And that was how long ago now, buddy?
Like 2 months
2 months ago? Okay. So just kind of tell me your story again. The one story I remember you sharing with me is the lightning bolt pain that you had. So kind of just tell me that. I mean, he was struggling with a lot of pain in his back, but he had an experience where he described it as lightning bolt pain. So just pick up from there.
I think I went through this pain for 12 years, and long time, never had anybody, never questioned anybody, never asked anything about it, just went through it. For about 5 months, I could hardly walk. That was a long time. At one point, I tried to get out of bed. My spine aligned directly on the nerve, and I felt like there was, like he said, a lightning bolt through my entire body. That lasted about an hour. I couldn't get the pain to relief. Nothing. It lasted for forever. At that point, I went to a hospital. Didn't get any information out of them. I got a spine shot, maybe a little bit better. Didn't last very long.
And they told you what? That you had inflammation?
They said that I had sciatica, and it was caused by swelling.
Yeah. And they gave you some medication and sent you on your way.
Correct. Yeah, it was. They gave me a shot and gave me some muscle relaxers. Didn't really do anything. I started walking a little bit better that day, and I was a little bit out of pain. The next day, it was right back to where it was before. Went a couple more weeks, was actually trying to figure out what to do about it. And then I found an online ad with Dr. Kern on it, and that was when I got here.
Yeah, and then from there, we ended up ordering an MRI relatively quickly, and then the results of the MRI came back, and you came in to talk with me about that. And we, from the MRI imaging, we determined that you've got 2 herniations in the lower back. And so, for those of you that are out there that are struggling with your back pain and you don't have any imaging done, that you could be dealing with something very similar that Ian's been dealing with. And if you can see, this is just a model. It has the bone and then the disc in between. And what happened in Ian's case is that disc just started bulging, and in his case, herniating, hitting that nerve, and was firing pain. It was down your left leg, right?
Yeah.
It's pretty neat, huh?
Yeah, I never seen it.
So anyway, we've got them on non-surgical spinal decompression therapy, and just tell them your experience after the first couple sessions that you had.
I went to my first session and didn't really know what to think. Did the thing with him, and immediately when I came home, I was told by my roommate that I was walking better than I had left that very day.
Yeah.
The pain didn't go away for 2 or 3 sessions. After 3 sessions, leg was almost better. I was walking just fine, starting to be active, and now I think I'm 2 months in, and I really couldn't tell you that there was anything wrong with me.
Yeah, he's done great. And he does really physical work, and his job's really physical, and we're battling with that because he's got to work and all of that. But he has done very, very well with the non-surgical spinal decompression therapy. And I challenge any of you that are here in the local area, you can look me up. LakelandDiscCenter.com is the best website to go to get a wealth of information. We are located in Lakeland, Florida, in between Tampa and Orlando. And would love for any of you out there that are looking for an alternative and not surgery and drugs and all of these things to contact my office, and we're here to help. So thank you so much, Ian, for sharing your testimony today. Appreciate that. Thank you so much.